The legacies of the late Chris Ramsey and Dr. Geer continue. The Minority Health Fair returns in person this year. I spoke with one of the organizers, Tony Salmons. The Minority Health Fair, back in person. It has been 3 years, so I'm sure you all are excited, and so are a lot of people eager to be able to get back out to the Minority Health Fair in person.
It is. It has been 3 years, and we've been kind of struggling from the. We've been so used to engaging with the community in person that it has been kind of a struggle not being able to do so. But we've been getting a lot of encouragement from the community and having us re-engage. So we're excited about it.
One of the things, just for people who they may be hearing this for the first time, maybe they recently moved to town during the pandemic, but the Minority Health Fair, one of the largest health fairs of its type in this area. It has been going on now, remind me, I know it's over 20 years. How many years, Tony?
21 years.
21 years. What is the secret behind the success? It continues to grow year after year, drawing more people, more vendors out.
Well, I guess our secret sauce is pretty much it is not your traditional health fair. It is more of a relaxed, it's more of a family reunion of sorts. And we have a host of vendors that are providing free health screenings as well as education information to all of our participants. And we have, in the past, we have been in excess of 100 vendors on site. And it's absolutely free. And it is just extremely engaging. We have not only the health screenings and education, but we also have entertainment. We also provide a lot of giveaway door prizes during the course of the time that we're engaging with all of our participants.
Now let's get back to the purpose of this, talking about the health fair. And health is something that we know there's such a disparity in the African American and communities of color when it comes to access, when it comes to this information and knowledge. And this is one of the ways to kind of bridge that gap and to try to work on that. And talk about that a little bit because one of the things we find out is that, and we saw this during COVID, especially, it was exposed even more.
It was. We started with this being a mission for us as one of our initiatives from our fraternity, and that was both Kappa Alpha Psi fraternity as well as Omega Psi Phi. We both shared that same initiative in addressing the disparities of health as it relates to African American men. And that started our drive, and we came together to try to bring those services and health related information to that populace. But we realized that it was not just the African American men, but we had that same disparity amongst people of color altogether. So we expanded it, and the ladies from Delta Sigma Theta joined us, and then we expanded to where it was for the family. And then we realized, even though we looked at it as the Minority Health Fair addressing those health disparities among African Americans, we realized people of color, regardless of their nationality, were experiencing those same disparities. And so we kept the name minority because those who are without health care and those not having those resources were able to take advantage of this. So we have no color. We have no specifics as it relates to that other than them being subjected to those disparities and receiving health screenings as well as education. And so we have grown over the 21 years in being able to address those disparities and trying to provide free screenings and free education information that will help us address those concerns head on.
And over the years, I know that I remember talking to some people myself about how they came to the health fair and a screening they got there potentially saved their life.
Absolutely. Over the years, we have had a number of participants who were either identified at having a level that is extremely necessary for them to go to the hospital or seek medical attention immediately. We've had people who we've had to have emergency technicians come out on site and address their concerns right then and there. And we've had testimonials from people over the years who have stated that had they not come to the health fair and realized how severe or how they were in much need to address certain health concerns, they pay homage to the health fair of being able to come there with not being concerned about what is it going to cost them, being able to address those things, and their lives have been saved.
We cannot let this interview go without, of course, talking about two people who will not be there this year. Your friend and mine, Chris Ramsey, and Dr. Michael Geer.
Absolutely.
Talk about carrying on that legacy, Tony.
Well, we have to. We all started this journey together, and we all started this journey addressing those disparities within our communities. And we lost them both to health-related issues. Of course, Chris, who was bigger than life, Dr. Geer, who was our engineer of sorts when it came to the medical world and addressing the various health concerns. He wanted to ensure that we had various screenings and made sure that we remain on this journey, providing these at no cost to the recipients. And Chris was the driver that led the way for us. And to have Chris succumb to what we all were fighting, that we were all surprised by being exposed to COVID-19, and then he losing his life to that. We have to continue to honor both he and Dr. Geer, and seeing that the health fair will continue to move forward, continue to grow, continue to provide the resources at no cost to our citizens here in the city.